Hypertension Awareness Series Episode 8A. How to measure blood pressure correctly. A simple test that very many people get wrong. Good morning. A wrong step can change your BP reading and your whole diagnosis. Hypertension is often diagnosed using blood pressure measurements. This is a simple test that is most of the times done wrongly. We said BP is blood pressure more than 140/90. It sounds simple, but it is one of the most incorrectly done tests in medicine. Inaccurate blood pressure measurements, often due to improper technique or faulty equipment, are very common and affect about 20 to 45% of the readings in different studies. And this leads to significant misdiagnosis. Wrong diagnosis, wrong treatment. If the measurement is wrong, the diagnosis will be wrong and the treatment will also be wrong. And now that more people are checking their BPs at home, the correct technique has never been more important. So let us get it right. How to measure BP correctly. Rest quietly for 5 minutes. No walking, no talking, no phone. Measuring immediately after an activity can raise your BP by about 10 to 20 millimeters of mercury. Number 2, no coffee, no smoking or exercise 30 minutes before. Coffee and energy drinks can raise your BP by about 5 to 10. Smoking can raise by about 10 to 20 millimeters, and exercise causes a temporary increase. Number 3, empty your bladder fast. This is very important and often ignored. A full bladder can raise your BP by about 10 to 15 millimeters of mercury. Sit correctly, sit upright, the back supported, the feet flat on the floor. Do not cross your legs. Crossed legs can raise your BP by 5 to 8 millimeters of mercury. Number 5, support the arm at the heart level. Rest your arm on a table or on an arm rest. Letting the arm hang down can raise your BP by about 10 millimeters of mercury. Number 6, and very important, use the right machine which is calibrated and on the upper arm. Wrist machines are often inaccurate. Use the correct cuff size and place it on the bare skin, not over the clothing. Number 7, do not talk during the measurements. Talking or laughing can raise your BP by about 10 to 15. Number 8, take at least 2 readings, 1 to 2 minutes between the readings, and record the average, not just the first number. So remember, that is how to measure your BP correctly. What about home BP monitoring? How often? For routine monitoring, you can even do about 3 times a week, all as advised by your doctor. Keep a simple log or a BP diary and share it with your doctor during the clinics. Daily checking is not necessary for most people who are stable and may also increase anxiety. Why is wrong technique dangerous? Wrong BP readings can lead to being started on unnecessary medication, missing true hypertension, thinking BP is controlled when it is not. So remember, good treatment starts with good measurements. With accurate measurements and accurate monitoring, this leads to correct diagnosis, correct treatment, and BP can be controlled and complications prevented. So stay tuned for our next episode, episode 8B, where we learn mismeasurement of blood pressure, common mistakes that can change your numbers. You'll be surprised how small mistakes can change your diagnosis. So Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.